March 2020. 31 days the world is not likely to soon forget. It was the month that a new coronavirus that had infected tens of thousands in China became a global pandemic. Take a look at the infection rates. On March the 1st, nearly 89,000 cases of COVID-19, the disease caused by the virus, had been reported worldwide. Then, the vast majority of the cases were still in China, the original epicenter of the disease. By the end of the month, infections worldwide increased nearly 10 times, to nearly 860,000 cases, and deaths soared from over 3,000 to more than 40,000. But how did things get so bad so quickly? Early March saw Iran and Italy suffer dramatic increases in infection numbers. Iran's health minister was one of the first public officials to be visibly sickened by the disease. Iran's epidemic reached the top levels of its government, and mass graves were dug in the countryside. In Italy, the virus spread fast, despite early attempts to protect citizens from the novel coronavirus. The nation had already declared a state of emergency by the end of January, after a Chinese couple holidaying in Rome tested positive for COVID-19. Italy reported its first local case on February 20th, but scientists believed the virus had already been circulating in the country for some time. During Italy's peak flu season, people were being diagnosed with influenza, when they may have actually had COVID-19. Infections in Italy rose from 4 cases on February 20th to nearly 106,000 by the end of March. By the end of the month, nearly 12,500 deaths related to COVID-19 were also recorded, more than 3 times the number of fatalities in China. This despite the government ordering a lockdown for the entire country on March the 9th.
Decisione giusta oggi è di restare a casa. Il futuro nostro dell'Italia è nelle nostre mani.
Visiting Chinese medical professionals said more needed to be done.
我看到了他的公交车还在运行，我看到了他的人还在运行，我看到酒店人还在聚会，我看到很多不戴口罩的。
After Italy, Spain has the most COVID-19 related deaths in the world. Nearly 8,500 people died in March, and infections there jumped more than 1,000 times. The Spanish government announced a near-total lockdown on March 15th to try to curb the spread of the virus, but after 2 weeks, thousands of new cases are still being reported every day, leaving hospitals overwhelmed and the health service at breaking point. While much of the rest of Europe restricted people's movements, the United Kingdom took a vastly different approach at first. In early March, Prime Minister Boris Johnson and his top medical and scientific advisors said it wasn't necessary for people to change their habits. They hoped to stagger the rate of infection in the British population so as not to overwhelm the public healthcare system. But the government soon changed its tune. A study by Imperial College London showed that the death toll for their strategy could reach as high as 250,000. As the number of new cases accelerated, Johnson was still only encouraging people to self-isolate when sick and to practice social distancing. Restaurants, pubs and entertainment venues remained open until finally on March 20th.
We are collectively telling cafes, pubs, bars and restaurants to close tonight as soon as they reasonably can and not to open tomorrow.
By then, nearly 4,000 people in the UK had tested positive for COVID-19. In the following days, Prince Charles tested positive and then Johnson himself became ill, running the government via video conferencing from self-isolation. Over the course of March, infections in the UK went from 36 to over 25,000, and from 0 fatalities on March the 1st, the country saw nearly 1,800 succumb to the disease by the end of the month.
We're talking about very small numbers in the United States.
We've all done a very good job.
That was President Donald Trump at the beginning of March, when there were 158 cases of COVID-19 in the United States. In 2 weeks, infections had risen to 9,197. Despite mixed messaging from the White House, the government did finally urge people to stay at home if they or a family member showed symptoms of the virus, and to limit gatherings to no more than 10 people.
We really want people to be separated at this time.
But in the 2 weeks following the plea, COVID-19 cases in the US increased to more than 188,000, and the death toll shot up to more than 4,000 people. President Trump backtracked from a plan to return America to work by Easter after his task force projected as many as 2.2 million Americans could die from COVID-19 if more action wasn't taken.
The better you do, the faster this whole nightmare will end. Therefore, we will be extending our guidelines to April 30th to slow the spread.
As global COVID-19 cases surged in March, life began to slowly return to normal in mainland China. The number of new infections and deaths plummeted in the country, with the majority of new cases being those imported from overseas. Officials credit the complete lockdown of Hubei province, as well as tight restrictions and quarantine rules in other cities, as being key factors in containing the virus. For many other countries still struggling to stop the spread of COVID-19, the next several weeks are crucial in determining whether April will be better than March.
中国武汉肺炎疫情，世界卫生组织正式将这个检出的病毒命名为2019新型冠状病毒。目前除了中国，包括台韩、新加坡、香港都有通报疑似的病例。
教授，现在大家都在问，武汉怎么会发生这么严重的新型冠状病毒的扩散？对，而且怎么会完全无法控制？本来以为说那是水产市场，可是没有哦。其实现在发现水产市场不是第一个现场哦。对，来我们看。 原来在当时12月的时候就已经发现人传人了，可是当时武汉的当局他们要压下消息，为了压下消息，他们怎样？还要故作太平状，完全的粉饰太平，还搞了一个万家宴。你想想看，你已经开始传染了，有新型的病毒了，只有上万个人跑到这边吃东西，就完了。
宝姐，这个万家宴是什么时候开的呢？是1月19号。1月19号什么意思？1月20号的时候，习近平正式承认要面对疫情，结果他们前一天 还举行万家宴，宝姐，这在哪里？就是在湖北市。湖北市市政府呢，就允许他们开这个万家宴。宝姐，那为什么叫万家宴呢？因为他们在百步亭社区里面有4万个家庭，然后每个家庭4万个家庭，然后每一个家庭呢都要出一道菜，所以一共出了15000多道菜，所以就摆在公开场合，然后大家就坐在那边边吃边喝。宝姐，我们知道这一次传染为什么？ 口沫传染，他们就在当场边吃边喝，然后在密闭空间里面，然后这样吃喝。抱歉，这是不是会导致疫情大爆发？因为他就在1月19号，当时武汉就已经爆发疫情，只是当局没有承认。对，就1月20号，习近平承认之后，就整个就往上飙升起来。所以现在很多人就讲说，会不会是因为这个万家宴导致这个整个武汉疫情控制不住，
一发不可收拾？
武汉肺炎疫情持续的扩散，近期网络上也出现了许多未经查证的假信息。
那么今天早上呢，卫生部就出面澄清呢，指网上流传5名未经过中国的本地人感染到武汉肺炎是一个假消息。
此外，时政网站也因散播我国口罩已经断货的谣言而被要求刊登更正。
是假信息呢，不时流传，对疫情的控制增添了不少挑战。那么面对未经查证的这个消息呢，公众该如何去分辨真假呢？则
不实的报道做出了更正的指示，这起到什么样的作用呢？
是这样子的，我觉得这次这个武汉新型冠状病毒它的这个爆发和扩散，我觉得它正好就是在一个互联网时代。 一个这个社交媒体特别蓬勃的时代背景之下发生的。所以我相信那些经历过SARS的国人呢，他们可能都会有所对比，会觉得说，哎，这次好像信息来得很快，而且大家可能都有很多的疑问，而且可能也会有一些焦虑和一些不安，因为每当获得一则社交媒体上的新闻，可能大家都会觉得说，哎，这是真的吗？好像有点吓人，或者是
几乎天天都有，
几乎天天都有。那么我觉得在这样子的一个情形之下，我们的防止网络假信息和网络操纵法令的作用就得到了发挥。那么在这样子的一个情况之下呢，其实我们当然我们也发现说，大部分的人他们都会想办法查证，而且我也相信，其实多数人都不愿意在没有查清真相的情况之下去转发这个假新闻。不过假新闻还是会出现。那么当我们援引这个法令的时候，其实应该说大部分的这个例子当中，这个获得指正的这个指示、更正指示的这个用户或者是平台，绝大部分他们都有配合。那我觉得这对公众是一件好事。